for kids 5 to 11, what the CDC and the FDA had to look at is assuring that we didn't have further adverse vaccine events associated with administering the vaccines before they gave that approval. And because they had this associated myocarditis, they had to look at that further and get reassurance and look at the current dosing that they were administering for the younger kids to assure that they weren't seeing other side effects or further side effects associated with myocarditis. They were looking at late summer, perhaps trying to initiate this vaccine, but because of these cases of myocarditis, it was important to gather more data. And the more data that you gather, the more that you can be reassured that this is a very extreme low number of cases. In fact, much lower than the number of individuals that have COVID-associated myocarditis or pericarditis. And so having those numbers to assure that we weren't giving an increased number of cases with younger children associated with this is reassuring. And so that's where the hope is that, yes, by October, they can give us that answer for that EUA. I think this is a very positive thing that's happening, that we are looking at that EUA approval, hopefully at the end of October. And what that will help with is sending our kids, continuing to send them back to school. And if they are vaccinated, then we can think about, potentials of when they get exposed, perhaps not obviously developing disease from COVID, or having much less side effects from the disease. So I think this is very reassuring, and it gives the parents that opportunity to get them feeling safer as their child gets back to school or back to other activities. If you compare getting COVID in comparison to getting the vaccine, your risk of developing myocarditis is much higher associated with getting COVID than with the vaccine itself. Me as a pediatrician, when I'm taking care of patients, I have my own book that I look at for information and my own resources, because their immune system is much different than the immune system of an adult. Even babies' immune systems are much different than immune systems of a child. And so we have to understand that when we are administering a vaccine, or if a child gets exposed to a certain virus, that their symptoms might be different. They might be less, they might be more. But we need to understand that population and not just rely completely on what we see for the adult population. That's a question I think that we still need to understand in time. When COVID-19 first came about, we were finding that less than 1% of our children were being hospitalized for COVID. But as COVID has mutated over time into different variants, we are seeing that more children are being hospitalized. Since the Delta variant came in, I've had more children in the hospital, and my colleagues have had more children in the hospital than we have seen over the past year and a half with COVID pneumonia. And so we don't know necessarily that it's going to continue to stray, that this is going to only be an adult severe disease process associated with COVID. This can traverse to our younger population. Even we worry about our infant population being really adversely affected by COVID. Children will be able to get their COVID vaccine at the same time as other vaccines. So what the CDC has said, and they've looked at also the association with receiving the vaccine in the adult population, and they've had the ability to give them at the same time and have not seen adverse effects. And so the CDC is currently stating that we can give them at the same time. Just as we know that young children are affected with different diseases and different viruses, different than our adults, there could be the potential for different side effects. And so it's important, again, that as children start to get vaccinated for COVID, that we continue to report certain side effects that we're seeing. It is possible, and so we always have to be constantly looking at that. If they're giving approval, I think the important thing is that you follow up with your pediatrician to assure that this is the right time for a child receiving the vaccine. If they're immunocompromised, then this may not be a good opportunity. And so it's important to follow up, especially if that child has other comorbidities, to assure that they are the appropriate setup to receive the vaccine. We start with simply talking about vaccines and what the vaccines do and how they can protect them from infection. And then we can focus on, things like the flu vaccine, which we have to receive on a yearly basis. And that's something that they each year try to look for the appropriate strain, and that vaccine changes each year. And then that this is a new vaccine, but this vaccine has provided immune support to protect individuals from dying from COVID. And if we can let them know to give that support, that we are giving something that has protected our adult population and has protected, family members that care for them, then that's important for them to understand that this is also something that can protect them as well. This has been hard for all scientists, for doctors, for the CDC, the World Health, because COVID is a new virus. COVID-19 is a new virus, and it's been around for the last year and a half. And they have had to constantly follow new data and look at the populations as more information has been brought to them. And so certain decisions that were made in a previous month may shift as that new data comes in, if they're seeing associations with COVID and other comorbidities, or they're seeing that the COVID strain is changing. So this is, as it changes, it may have a different defense system that we can't fight off. And so we have to constantly be thinking and looking at that, as well as looking at the individuals that are receiving the vaccines and looking at the side effects. And that's why there's a constant system that's updating. And it can be sometimes day by day, we feel that we're gathering information, and we feel that it's important that we continue to update, our population so that we can build and ensure that trust. And so if you report that real-time data and then it shifts over time, then sometimes I know, and that we can understand that can sometimes be a little bit confusing, but it's important that we share that real-time information and then understand that information can change as we look at it over time. When the clinical trial came up for my 13-year-old daughter at the time, I had to put trust in the science that I know and how I use that science to take care of my patients. That doesn't necessarily mean that I was not afraid. I think, there is always, when you're in a study, there's questions that aren't completely answered. And so you need to either make that decision to wait for those answers, or you can contribute and be a part of science and then also have an opportunity to protect your child. And so that was something, it was weighing that decision-making process to understand that. And really what we already knew about the vaccine with adults receiving it, knowing that she was kind of reaching into those adult ages, and then perhaps that those side effects, she would be okay and not be experiencing adverse side effects. And so this was something that we had to talk about, but there still is some uncertainty there. It's though that we have that potential to contribute to science and then also to protect our own child. And if our child, she was in support of that, we needed to explain those risks and benefits with her. And so this became a group decision and an important decision that we were able to move forward and to get her vaccinated at the time.